As Rakim would say, it's been a long time. I shouldn't have left you. I'm so sorry it's been so long since I've posted a quick hitting high yield review on a medical topic in 5 minutes or less. I'm going to try to do a better job of posting more regular topics. For those of y'all who are new to this, I post efficient videos that review medical topics in 5 minutes or less. If you're a student or a learner, this will help you improve your exam performance and boost your medical knowledge. If you're a clinician, this is a quick way to review a topic that you may see on a regular basis or that you just want a refresher on. Again, I'm not giving you medical advice or telling you how to practice, just reviewing general guidelines. If you like that kind of content, make sure you subscribe to my channel. If you're watching this on a platform other than YouTube, go ahead and jump on over to my YouTube channel and subscribe to my channel, Dr. Bonzo. Today's topic is short-acting birth control or combined hormone contraceptives, CHCs. We're not talking about long-acting reversible contraception or LARC today. Those are most of your progesterone only or your non-hormonal methods. We're talking about combined estrogen and progesterone short-acting birth control. There's 5 things I want you to know about today. Number 1 is, what are these methods? Well, there's a vaginal ring that you can insert once a month, a patch you can apply to your skin once a week, or a pill you take by mouth once a day. Now there's 2 different kinds of pills, so it can get confusing. There's a progestin-only pill, or POP, that most people refer to as a mini pill. We're not talking about that today. Today we're talking about combined estrogen and progesterone birth control pills. Most people refer to those as OCPs, or oral contraceptive pills. Again, both methods of pills are oral and they're contraceptives, but OCPs usually refers to the combined oral estrogen and progesterone methods. So how do all these estrogen and progesterone methods work? The main answer is they block ovulation. They can do other things like thicken cervical mucus, make it hard for sperm to get in, but they block ovulation, so if a sperm does sneak in there, there's no egg that's released, so there's nothing to fertilize. So what's the first thing you need to do before you start these methods? The most important thing is check blood pressure. A lot of students miss this on exams and they get frustrated because they say, before you start birth control, the most important thing is make sure the lady's not pregnant, right? Well, if a woman's pregnant, you give her a few days of birth control pills, it's probably not gonna hurt anything. However, if she has a history of high blood pressure and you don't realize it, and you start birth control pills, you can actually cause problems. Remember, these estrogen-containing methods, estrogen is the one that causes most of the nasty side effects. It's the one that raises your blood pressure. It's the hormone that gives you the headaches and the nausea and the clot risk. So that segues into the third point, which is, what are reasons to not use these methods? Well, I mentioned clot risk. If you got any personal history or any hypercoagulable state, don't use them. Factor V Leiden, anti-phospholipid syndrome, any personal history of heart attacks or strokes, super strong family history of all these conditions at a young age. If anybody has a history of DVTs or PEs, blood clots in the lungs or the legs, don't do it. Also, if you're a smoker over age 35, the clot risk is too high, don't do it. First 3 weeks postpartum, in other words, if you're within 21 days after having a baby, clot risk too high, don't do it. As a side note, if you're within the first 6 months postpartum and you're breastfeeding, you probably shouldn't do it because estrogen can interfere with prolactin and decrease your milk production. And then the last 2 things people forget about is if you have a history of liver disease, don't do it, contraindicated with estrogen. And also if you have a history of migraine headaches with aura, then that increases your stroke risk if you use estrogen, so you shouldn't do it. So last topic is, how do you choose out of all these methods? Well, there's not really a lot of difference between them. All the estrogen and all these combined methods is in the form of ethinyl estradiol. The main difference with the pills is sort of how much is in there. There's some doses anywhere from 20 to 35 micrograms. The higher the dose of estrogen, the more side effects, but the more regular, like clockwork periods you'll have. The lower dose, less side effects, but more likely to have some irregular or breakthrough bleeding. As far as which progesterone method do you choose, it's up to the patient and probably your insurance company. There's some progesterones that are marketed towards certain things. Drospirenone, which is in Yaz, is marketed towards improving premenstrual dysphoric disorder. Ortho Tri-Cyclen and Ortho have norgestimate. Those are marketed towards improving acne and are actually FDA approved for improving acne. And there's other methods as well. The ring and the patch are a lot more expensive. They're usually anywhere between $80 and $140, although they're convenient because you don't have to take them every day. The birth control pills, the generics, you can usually get for about $9 at certain pharmacies. So again, in summary, what are the things to know about? We know what these methods are. They combine estrogen and progesterone. We know how they work by blocking ovulation. Don't use them if you're a smoker over 35. If you have any clotting risk at all, if you're within the first 3 weeks postpartum, if you have liver disease, or if you have migraine headaches with aura. And as far as which one you choose, let the woman decide. If she can take a pill every day and stay with it, then more power to her. Let her take the pills. If she needs a longer acting method and either has insurance or has the means to afford them, let her roll with that. All right, again, Dr. Bonzo, 5 minutes or less.